Do you know that more than 20 million people in United States may have some level of kidney disease and many of them don't even know it? It is a serious condition that can affect your heart, bones, immune system and brain. It can lead to kidney failure that requires dialysis or transplant to survive. But how did you know that some of your daily habits every day you do without thinking can be damaging your kidneys without knowing about it? In this video, we will reveal 10 daily habits that can damage your kidneys and how to stop them before it's too late. So without further ado, let's get started. First, taking too many painkillers. Lot of people use over-counter painkillers like NSAIDs and analgesics to ease their pain. But these drugs can severely harm your kidneys, especially if you have kidney disease or take them a lot or in high doses. According to National Kidney Foundation, NSAIDs can lower the blood flow to the kidney and cause inflammation and scarring in the kidney tissues. Like acetaminophen and aspirin can also damage your kidneys if you take them too often or in large amount. So what can you do to protect your kidneys from these painkillers? Best thing is use to them as little as possible and never go above the recommended dose. If you have chronic pain, talk to your doctor that how to deal with it. Therapy, acupuncture or like meditation. Second habit, eating too much salt. Salt is very important for our body, but to maintain the helps to maintain the fluid balance, nerve and muscle function. But too much of it can be very bad for your kidney because salt has sodium, which can raise your blood pressure and make your kidneys work harder to get rid of the fluid and sodium from your body. High blood pressure can damage the tiny blood vessel in your kidneys and reduce their ability to filter your blood. In fact, it is one of the main causes of kidney damage and its failure. How we know that how much salt is too much salt? According to American Heart Association, you should limit your sodium intake to no more than 2300 milligrams per day, which is about 1 teaspoon of salt. Most people eat way more than that, mostly from the processed food that are high in sodium like frozen meals, soups, sauces, snacks and condiments. To cut down on salt, try to eat more fresh fruits and vegetables. Make your own food using herbs and spices instead of salts. Look to the nutrition labels while buying the packaged food. Third, ignoring urination surges. Do you ever hold your pee when you're bathing or don't have a bathroom nearby? I think yes. So if you do, you may be putting your kidney at risk. When you ignore your urination urges, you are getting urine stay longer than required time in your bladder, and this increases the chances of UTIs. UTIs can be very painful and annoying, and if you don't treat them, they can spread to your kidneys and cause serious damage. What you can do to prevent UTIs and protect your kidneys? Best thing is to listen to your body and go to the bathroom whenever and wherever place you need. Don't hold your pee for more than 2 to 4 hours. Try to empty your bladder as soon as possible. Fourth, not getting enough sleep. Sleep is essential for your health and well being. So, but did you know that sleep also affects your kidney health? Your body follows a circadian rhythm, also known as sleep rhythm, that regulates your body's function and activity. When you sleep, your kidneys reduce their workload and rest. When you wake up, your kidneys start resuming their normal function and filter more and more blood. This cycle helps to maintain your kidneys' efficiency and work productivity. But when you don't get enough sleep, your sleep cycle is disrupted. Your kidneys can also get affected. According to American Society of Nephrology, people who slept less than 5 hours per night and are 60% higher risk of developing kidney diseases. But then those who slept 7 to 8 hours per night, another study per night also had a higher risk of kidney diseases, suggesting that both too little and too much sleep can be harmful. The recommended amount of sleep for adults is 7 to 9 hours per night. To improve your sleep and by quality and quantity, try to follow a schedule. Avoid caffeine, alcohol, nicotine, and avoid heavy meals before going to bed. Limit screen time exposure to bright light. Create a comfortable and dark environment while sleeping. Practice relaxation and meditation techniques before going to sleep or breathing exercises. Fifth habit is eating lots of meat. Protein is a very good content for our body, but too much animal protein can be bad for your kidneys. Animal protein makes a lot of acid in our blood that can hurt the kidney and cause acidosis, which is a condition where kidneys can get rid of acid fast enough, which can lead to the kidney stones, bone loss, muscle wasting, and many chronic kidney diseases. So, how much protein do you need? Dietary deficiency intake for protein is 0.8 grams per kilogram of body weight per day for adults. So, this means that an average person who weighs 70 kilograms need about 56 grams of protein per day. So this much amount is considered because this amount may change depending upon your age, activity level, health status, and personal preferences. To keep your protein intake balanced, try to eat more plant-based sources of protein in your diet like beans, lentils, nuts, seeds, tofu, and quinoa. These foods are not only high in proteins but also low in acid and high in fiber and antioxidants. Because sixth habit is not drinking enough water. Water is essential for life and also for your kidneys, which helps to flush out the toxins and waste products from your body. Without enough water, your kidney cannot filter up the waste presence in your blood, cause kidney stones and other kidney failure diseases. So drinking plenty of water is the best way to avoid the kidney problems such as kidney stones and failure. How much do you water need? According to the age, weight, active level, climate and health condition, each and every body person's amount of water intake differ. A general rule of thumb is to drink at least 1.5 to 2 liters of water every day. This is a normal quantity. However, if you need, you may also drink less or more water depending upon your age and everything. You should stay hydrated every time, especially before, during, and after exercise. You can also drink other fluids such as herbal teas, juices, or soups to compensate water loss in your body, but avoid drinking such beverages having high alcohol or sugar content. Seventh habit is eating processed food because they have been altered from the natural taste, usually by adding preservatives, salt, sugar, artificial flavors, and most importantly, the colors. They are convenient and tasty, but they are also bad for your kidneys. This is because processed food are very high in sodium and phosphorus, two minerals that can cause having high blood pressure and kidney stones if consumed in excess. Also puts a strain on your kidneys for the filtering the blood. While kidney stones when formed are painful deposits of minerals formed in a urinary tract. According to American Journal of Kidney Diseases, people who eat more processed food have high levels of phosphorus in their blood, which can lead to kidney damage over time. So, what can you do to avoid the processed foods? Try to eat more fresh fruits and vegetables, grains, lean proteins, and healthy fats. Cook your own meals at home as possible. Use herbs and spices instead of salt to flavor your food. Read the nutrition labels on packaged food and choose low sodium and low packaged phosphorus options. 8. Not exercising enough. Exercise helps to maintain body weight, which reduces the risk of obesity and diabetes, two of the leading causes of kidney diseases. Exercise also helps lower the blood pressure, which protects your kidney from damage, according to American Society of Nephrology. Exercises can significantly lower the risk of developing kidney diseases than those who did not. Recommended amount of exercise for adults is at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity physical activity per week. You can also do muscle strengthening exercises at least twice a week. Ninth habit is smoking. Smoking is one of the worst habits you can have for your health in general, but especially for your kidneys. It damages your blood vessels, which reduces the blood flow to your kidneys. This can impair their ability to function properly and filter out waste and toxins. Smoking also increases risk of developing kidney cancer, one of the most common types of cancer. According to American Society of Nephrology, you can see that smokers had a 60% higher risk of developing kidney failures than non-smokers. So the most important thing here is to stop smoking as soon as possible. Remember that quitting smoking is not only good for our kidneys but also for our brain, heart, skin, teeth, and most importantly, lungs. 10th habit, drinking too much alcohol. It is a diuretic, which means it makes you urinate more often. It can dehydrate your kidney by removing out the excess water content in our body, which is required for maintaining the fluid balance. It can also affect the liver, which can lead to the swelling of the liver cells causing hepatomegalia. When you drink too much alcohol, your liver produces more urea than your kidney can handle, which can cause kidney damage. So what can you do to limit your alcohol intake? Recommended limit for alcohol consumption is no more than 1 drink per day for women and 2 drinks per day for men. If you drink alcohol, drink it slowly and with food, and or alternate with water or other non-alcoholic beverages. Avoid drinking on an empty stomach or when you are thirsty or tired. Your kidneys are vital organs that deserve your care and attention. So, avoiding these habits, you can improve your kidney health and prevent or delay the progression of kidney diseases.